12 popular supplements that harm your liver and kidneys. If you're someone who loves taking care of their health and has jumped on the bandwagon of dietary supplements, multivitamins, multiminerals, and proteins, you're not alone. After all, who doesn't want to give their body a boost and feel in the best shape possible? But here's an important warning. Excessive use of these supplements can bring more risks than benefits to your health, and that's what we'll explore in today's video. It's true, the various compounds present in them can end up overloading your liver and kidneys. So before getting too excited, it's always good to keep an eye on the impacts these supplements might have over time. Therefore, in today's video, we'll reveal the 12 popular supplements that harm your liver and kidneys and 6 dangerous ingredients found in supplements, so you can be aware of all the hidden risks behind this health trend. And I'll give you a heads up that supplement number 8 is the most dangerous. Before we dive deeper, I ask you to subscribe to the channel so it can grow and bring more videos like this to you, and consider joining our members area, where we share more valuable and exclusive tips for members. Number 1. Multivitamins and multiminerals. They are super popular among those who want to boost their health, offering a quick and convenient way to meet your body's nutrient needs. But here's an important truth I need to share with you. These supplements do not replace a balanced diet, and believe it or not, they can end up doing more harm than good to your kidneys and liver if used improperly over a long period. The problem is that, when consumed for extended periods, these complexes full of vitamins and minerals can overload these essential organs. Therefore, it's always good to stay alert, and remember that a healthy diet should be the foundation for well-being, not just supplements. These supplements can have unexpected effects and cause serious problems in your body. They can lead to the accumulation of mineral residues in the kidneys, increasing the risk of kidney stones and compromising kidney function. Additionally, many vitamins are processed by the liver, and if consumed in large quantities, can overload this organ. Many of these vitamins are fat-soluble, which means they are stored in the liver. Over time, this can lead to issues like hepatotoxicity, where the liver suffers damage due to excess substances. Therefore, it's crucial to use supplements with caution and always prefer a balanced diet. Number 2. Vitamin D. It is essential for the health of our bones and for calcium absorption, helping to maintain bone density and prevent weaknesses. Without vitamin D, calcium does not properly fix in the bones, which can lead to serious health problems in your body. Naturally, we get vitamin D by exposing ourselves to the sun for about 15 to 30 minutes daily. If you've already been exposed to sunlight at work or throughout your day for more than 20 minutes, supplementation might not be necessary. But in today's world, and especially here in the United States, many people face vitamin D deficiency for 2 main reasons. First, we spend a lot of time indoors and use sunscreen, limiting our sun exposure. Second, few foods contain this vitamin in sufficient amounts. Therefore, it's important to monitor your levels and seek a balanced solution to ensure you're getting enough sunlight in your day. Number 3. Red yeast rice. This supplement is made by cultivating the fungus asterisk, Monascus purpureus asterisk, on white rice, which gives it a reddish color and adds some health benefits. Red yeast rice is rich in monocolin K, a compound that can help reduce bad cholesterol and triglycerides in the blood. In fact, monocolin K is also the active ingredient in lovastatin, a medication used to control cholesterol. But it's important to keep in mind that the side effects of red yeast rice can be similar to those of lovastatin, including the risk of liver damage over time. Therefore, if you're considering including this supplement in your diet, consult your nutritionist to avoid problems over time. Number 4. Cava. This plant, originating from the Pacific Islands, has a long history as a medicinal herb and ceremonial and social drink. Known for its sedative and calming effects, kava is currently used in the United States to treat anxiety and stress, as well as promote muscle relaxation and act as an analgesic. However, it is important to note that, in recent years, some compounds in kava have been found to cause severe liver damage over time. As a result, the use of this supplement has been banned in countries like Australia, Singapore, Canada, Germany, and the United Kingdom. Extreme caution is necessary, as frequent and uncontrolled use can lead to serious health problems such as hepatitis, liver failure, and cirrhosis. Therefore, it is crucial to use kava with utmost caution and always seek medical and nutritional guidance to follow your diet correctly. Number 5. St. Johns Wort. Very popular in supplements here in the United States for relieving anxiety, depression, and sleep disorders, this plant is also used to treat kidney problems, menopause, and neurological changes. However, it is important to be aware that St. Johns Wort can dangerously interact with a variety of medications, including antidepressants, HIV treatments, and chemotherapy, as shown by several scientific studies. Therefore, if you're considering using this herb in your diet, reconsider and consult your nutritionist to ensure safety in your specific case. Number 6. Calcium. Widely used in the United States, especially by women in menopause and over 50. Calcium is known for helping reduce the risk of osteoporosis and maintaining bone density in your body. However, it's important to remember that excess calcium can be harmful to your health. When consumed in large quantities, calcium can accumulate in the arteries, increasing the risk of atherosclerosis and affecting heart health. This accumulation can harden the arteries and cause serious problems for your heart. It's important to balance your calcium intake and consult a healthcare professional to ensure you're consuming the right amount. Number 7. Green tea extract. Derived from the plant asterisk, Camellia sinensis asterisk. Green tea extract has gained popularity in the United States in recent years due to its potential health benefits, especially as a weight loss supplement and energizing drink among young people. Known for its thermogenic effect and being rich in antioxidants, green tea helps reduce fat absorption. However, it's very important to be aware that excessive and uncontrolled consumption of this extract can lead to long-term renal and hepatic damage. Therefore, we always recommend that, before using this supplement, you consult a nutritionist to avoid potential adverse effects. Number 8. Proteins. As I mentioned at the beginning of the video, this is one of the most dangerous as it is the most used by Americans in the past year. Protein supplementation has become extremely popular in the United States, especially for increasing muscle mass and improving performance in strength training, being very common among bodybuilders. However, it is important to note that excessive consumption, particularly of unsupervised supplements, can be harmful to renal and hepatic health. Excess protein needs to be excreted by the body, which can overload the kidneys and, in the long run, lead to problems such as kidney stones and even renal failure. Therefore, it is essential to use protein supplements, creatine or any other supplement with care, and always with medical guidance. Number 9. L-carnitine. It is a popular supplement for weight loss and increased energy, often used before workouts by many athletes for muscle gain. However, in very high doses, it can cause stress to the kidneys and liver. L-carnitine can increase the production of metabolic waste that the kidneys need to filter, leading to potential kidney damage over time. It's important to use L-carnitine responsibly and follow the dosage guidelines specified by your nutritionist to avoid overloading the kidneys. Number 10. Tribulus terrestris. The asterisk. Tribulus terrestris asterisk plant is popular among American athletes in supplements aimed at increasing libido and muscle strength. It is often used by people starting their workouts at the gym. However, it is important to use it properly as high doses can be harmful to the body. This supplement can alter hormonal levels and affect liver and kidney function. Although it is an effective supplement, it should be used responsibly. Number 11. Synephrine. Synephrine is a compound found in some popular American supplements for weight loss and increased energy in workouts and daily life. However, it's important to be cautious when using it, as it can cause serious problems for the liver and heart, including increased blood pressure and arrhythmias. Its effects may be similar to those of ephedra, but with a less studied safety profile and fewer available studies. Therefore, it is advisable to avoid using supplements with synephrine, or use them with extreme caution, always under medical supervision. Number 12. N-acetylcysteine, NAC. NAC is known for its antioxidant properties and is often used in the treatment of respiratory diseases. However, excessive use can cause liver and kidney damage, leading to hepatotoxicity, according to some studies. Additionally, NAC can interfere with the metabolism of some medications and increase the load on the liver. Therefore, it is crucial to follow recommended dosages and monitor liver function, especially in individuals with pre-existing liver conditions. Remember to always consult your doctor and nutritionist before starting any supplement. If you liked the video, leave a comment about which of these supplements you already knew could affect the liver and kidneys, and which ones you have used or stopped using. We will read all comments.